First tonight in our top story, it appears a second case of measles has been confirmed in the Upper Peninsula. Yesterday, the Marquette County Health Department announcing someone carrying the virus had spent time at 3 locations in the city of Marquette between May 19th and the 21st, including a Midas Service Center, Moon Spun Wool, and the Marquette Food Co-op. Tonight, the Western Upper Peninsula Health Department warning of another positive case in 2 new locations of concern. We're told the Marquette County resident now staying with a family in Ontonagon may have exposed people at UPHS Express Care in Houghton around noon last Monday and at the Aspirus Ironwood Emergency Room around the same time on Tuesday. For what you need to know, MyUP's Skylar Perkins has answers about just how dangerous that virus is and what health officials are expecting as they closely monitor that spread. Skylar?
The actual infection itself is pretty nasty. It's scary to watch a small child have measles.
After 2 confirmed cases of measles were found in the Upper Peninsula, health officials have been quick to take action, and for good reason.
Measles is one of the most infectious and contagious infections that we're aware of.
That's Dr. Bob Van Lowe, director of the Marquette County Health Department. He told us if one infected person encounters 10 vulnerable people, chances are 9 are going to contract the virus. For reference, that means it's 3 to 4 times more infectious than COVID-19.
20% end up being hospitalized. Number will develop pneumonia. Number will develop ear infections. Some can develop inflammation of the brain, and about 1 in 1,000 will die.
In fact, we discovered a startling new statistic from the organization. Their latest data shows the Marquette outbreak is one of 14 this year that have led to over 1,000 cases and 3 deaths. That means in less than half a year, the U.S. has seen nearly 4 times the amount of infections when compared to 2024, a year the CDC says no measles-related deaths occurred. Now, the bulk of the latest infections are from outbreaks in and around Texas, where the CDC says close-knit communities with low vaccination rates have been the most impacted. Up here in the UP, Dr. Lowe says our community has a vaccination rate of about 85%.
We'd like to have it around 95% because that's what you need to develop herd immunity.
He said it's also the best way to protect yourself.
If you have 1 vaccination shot, it's 93% protective. If you have 2 vaccination shots, it's 97% effective. If you don't want to get measles, get vaccinated.
For our latest list of possible exposure sites and contact information, you can find that on our website. In Marquette, I'm Skylar Perkins from MyUP News.